Hello and welcome to my series Learn Radiology with Dr. Anil Joshi. Today's topic is ultrasound and basic production of ultrasound wave. What is the role of quartz, that is what is a piezoelectric effect, and how with the help of piezoelectric effect we can image in ultrasound is what we are going to see, and what is the physics behind it will be seen in today's lecture. Initially, a disclaimer. Most of the material is from our department. Some may be taken from the net, which is a royalty free. We acknowledge with thanks from whom the material has come. Now let's go to the basic, that is the U.S.G physics behind ultrasound wave production. Now we'll go to piezoelectric effect, how it works, what is a piezoelectric effect, what is a reversal of piezoelectric effect, all we are going to see in this lecture. So let's get going. It was discovered by Marie Curie in 1880. Now, when electricity is applied to the piezoelectric crystal, it causes it to expand and contract. That is a vibration. Electric energy sets a quartz into vibration, and then electricity is converted into ultrasound wave by a phenomenon called a piezoelectric effect, and the crystal which has got these unique characteristics are called as piezoelectric crystals. Now they have got capable of vice versa also. What it means, when an ultrasound wave is applied to it, it again sets it into vibration, and that causes another set of signals which are sent back to the monitor, and this is directly proportional to the ultrasound waves they are coming back. Now this is a vice versa and a direct piezoelectric effect. What is the basic principle of ultrasound study, ultrasound machines, ultrasound diagnosis? So it is very important, and all the crystals do not have this property. Some of the crystals has got it, and they also has got a limited ultrasound waves, that is frequency they vibrate has got limitations. So often nowadays what we are doing is we are producing in laboratory artificial crystals of our required density. Now here we are shown in diagram how a production of ultrasound wave is done by transmission of the electric energy into mechanical and then into ultrasound, then again back to ultrasound, and that causes a crystal to vibrate, and that again gives a signal, that is conversion of ultrasound wave into electrical energy. So that is how a phenomena takes place, and we get the images. Here we are shown on tabulation form, right from the production, then is a transmission, then is a refraction or transmission, then is a detection of ultrasound, then is acquisition of the image, and last is a display, what we see on the monitor. So that's how it goes. Now what is the mechanism of production of ultrasound waves? An alternating current is applied to the piezoelectric effect. Now this causes it to vibrate at a high frequency. These vibrations produce ultrasound waves. These ultrasound waves travel through the body and come back to the crystal, and depending on the waves coming back, they produce the signal. First is a piezoelectric effect, conversion of electric energy into ultrasound energy. Second is a reverse piezoelectric effect, that is conversion of ultrasound waves into electric energy. So that's how the ultrasound physics works. Now whatever signal come back to the crystal are converted electricity that are again sent back to the machine. Sometimes we enhance them, these signals are enhanced, or sometimes they are displayed directly. So that is on the monitor. So ultrasound machine has got component like a probe which produces ultrasound waves, receives them back, sends back to the CPU where they are processed, they are enhanced, they are stored, they are displayed, or sometimes we got post-processing also in them. All these things are done in a CPU and applicable softwares. Now what are the basic properties of ultrasound waves? Let's come to frequency. What is the frequency? Ultrasound generally refers to a ultrasound wave with frequencies in the range of 1 to 20 million, that is megahertz is a normal frequency which we use into the routine medical practice. So the frequency of ultrasound is 1 to 20 million MHz, out of which, as the frequency is higher, we get superficial structure better and there is less penetration. Now, audible range of ultrasound is between 20 to 20,000 Hertz. Please remember, these are Hertz and not megahertz. Megahertz are the millions and these are just a Hertz what we hear. Now the difference between what we hear, that is the sound waves and ultrasound waves. Now frequency refers to the number of cycles of compressions and rarefaction in a sound wave per second. Now one cycle per second is equivalent to 1 Hertz. Now let us come to the another characteristic, that is the basic of the ultrasound, that is wavelength. Now what is a wavelength? It's the distance traveled by a sound in one cycle, or a distance between two identical points in a wave cycle. That is the distance from a peak point to the another peak point of the two cycles gives you a wavelength. It is inversely proportional to frequency. So more is the frequency, less is the wavelength. Now, wavelength is one of the main factors affecting axial resolution of an ultrasound image. The similar the wavelengths, and therefore higher the frequencies, the higher will be the resolutions. So a small wavelength will have more frequency, higher frequency, and it will give you a higher resolution. But laser penetration will not be as good as that of the low frequencies. Therefore, higher frequency probe like 5 to 15 provides better resolution, but can be applied only for the superficial structures, or they can be applied in small parts like testes, breast, thyroid, or they can be even applied in neonates, small children. So there we need less penetration. The anatomical examination part is a smaller one. Now what is the basic physics? Now coming to the velocity. What is the velocity? The propagation velocity is the velocity at which sound wave travels to the particular medium and is dependent on the compressibility and density of the medium. So these are the two things which we must know. Usually, harder the tissues, the faster will be the propagation. So it will be more in the bones as compared to the soft tissues. The average velocity of sound in soft tissues such as chest wall, heart is 1540 meters per second, and there it undergoes interaction. Now, interaction is determined by how far ultrasound can travel in the tissues. The frequency of the transducer we have to decide before examining the part, because that is the one which is going to decide which will be seen clearly. Now, the higher is the frequency, less it can penetrate. Sound waves will penetrate less. The lower is the frequency, deeper it will penetrate. Now, attenuation is directly related to the frequency. Now, higher is the frequency, there will be high attenuation. So, it will not penetrate deeper. Now, we should know what are the approximate densities through which a sound wave travel in the body. Now, air, if it is in the body, it will go with the 330 meter per second. Then fat, 1400. If you see carefully, fat, water, soft tissues, liver, kidneys, blood and muscles, there is not much difference. Major difference is air, soft tissues and bones. So that is what we should remember when we are projecting or selecting ultrasound machine, particularly the probes. Now with that we are coming to a small lecture. Now there are different lectures covering different portions of ultrasound, extensively covered in my website on some other lectures, as well as they are available on YouTube. Do visit our website. The matters are extensively described there. So also there are a lot of other topics. All the modalities of radiology are utilized. Do make use of it for your knowledge. If you are exam going students, it will be helpful for your examination. There are spotters, there are interesting cases. Do visit the website. Till then, thanks for giving me your valuable time. Please give your best to the patient, and if you want to give best to the patient, you must know the physics behind the modality. So that's why you should know physics as well as the machines in detail to make best use of them. Thank you, take care, and do visit our website so that we can meet again over a other lecture.